Once you decided that this was the moment, how did you go about developing this?
So, well, first, when we first had the idea at IHI, we started with a listening tour, actually, where we went and talked to a bunch of organizations that we thought were leaders in safety to validate that others agreed that this was a good idea. And I have to say, and actually Jeff was, I think, the first person I talked to about this idea. And what was really great to see was literally every organization we talked to said, yes, we think this is a really good idea, and yes, we would love to work together on this. So, that was validating. So we brought the group together. One of our biggest challenges was deciding who would be on the committee, because there's so many organizations working on safety. And one of the things that we want to make sure is clear is, even though we had 27 organizations on the committee, we know that there's many more out there that we want to partner with and who we think can help be real effectors of the recommendations in the plan. But we had to start somewhere, and so we started with that group of 27 organizations. And then we came together and, through some consensus work and other things, decided on the 4 areas that would be in the plan, which I have to say came together pretty quickly. And it became quite clear that there was real consensus about the 4 areas that we landed on, which were leadership and culture, workforce safety, patient engagement, and the learning system. And then we created subcommittees that included members from our steering committee and also members from outside the steering committee to really work through what were the specific recommendations in those areas and the specific strategies, tactics, et cetera, that would go underneath those. And those subcommittees did a huge amount of work, iterating over time to get to the final plan. And so, the work of those committees was really instrumental, and then we pulled that all together to create the final plan that we'll be releasing in September.
Dr. Brady, anything to add?
That was a great description. The thing I would add that Tejal really touched on a little bit already is how much it was, how helpful it was to have people who on the committee who, number one, were very experienced in specific detailed areas. So we had some deep experience in, all the different areas that were covered, lots of wisdom, if you will, from the field and from these experts. In addition to that, I think, without exception, everybody on the committee also had an appreciation for the bigger picture. And I think that's kind of what we've tried to capture here, is a fair amount of detail and specificity, but also the bigger picture and showing how everything fits together. And so in terms of our development and how we did it, it really helped to have people who had those perspectives, both of them at the same time. So hopefully we can bring some of that out in the plan for others.